And I again re-welcome all our colleagues who joined us, our guests here. This project mainly started with Dr. Marianne Baker and I, maybe now almost 6 years ago. So we'll share with you our journey, and both of us have nothing to disclose other than being hired by Cornell. So this is the outline of what we're going to talk about. I'll give you a brief about the background, objectives, how we did it, some results, and look at outcome, and also definitely we'll share some challenges. So many of you might now be aware that our main teaching hospital is Hamad Medical Corporation, and it is really a very big hospital made of 8 different hospitals with a big community of health professionals who have different backgrounds. And when we started this, there wasn't much of faculty development. There were a few courses which were instrumental, but there wasn't a lot of other courses happening. So we thought about how we can help everyone. And as you know, Hamad is geographically away from the college, and we have this diverse, so we thought about how we can do this. We also have our affiliates, mainly the primary healthcare centers, and we have also Aspitar, and now Sidra is evolving too. So I visited at that time our Associate Dean for Medical Education with some enthusiasm about some faculty development, Dr. Maya Hamoud at that time, and she said, you know what, there is an association called International Association of Medical Science Educators. It's an international organization, and they have webinars. Why don't you try it and see what happens? And basically, when I looked at it, and it's still doing the same thing, they have 2 to 3 themes per year, and each theme, and I will show you some examples, is formed of like 6 different webinars, 5 to 6, each one is 1 hour, and they do it weekly. And then it's only 50 minutes to 1 hour. They usually run it live, definitely. And then they have it, though, at noon Eastern time. So we're like 7,000 miles away, so it's like 8 p.m., 9 p.m. We said, okay. So Marianne and I, we tried it, and I will share with you what happened. And our main objective when we captured this and we tried it is, first of all, to create a welcoming environment for discussions, and also engage the faculty from both institutions and the others in some medical education discussion. Because what happened is, at that time, we have the Stanford course, and Dr. Skiff here and his colleague. And I wasn't sure how people felt about it, and it was excellent. They learned a lot. However, we felt, okay, let's figure out how they think and how they process things. And we want continuation. It's not like one-time course and then everything is not available. So we tried to see something else to continue this. We want to think about, we wanted to elaborate and reflect on the information presented in the webinar. So the webinar is 1 hour, like any webinar you're familiar with. You listen to it, you have some questions you can ask online, and we're done. But then we thought, why don't we add another hour of discussion? Like, we attend the webinar together, they finish what they need to finish, we hang up, and then we continue the discussion. And actually, what I'm going to share with you is mainly related to that 1 hour of discussion. And then this will give us all opportunity for some faculty development in a distant place, where we are now, and also gives an opportunity for collaboration. So first of all, to do this, we have to subscribe as an institution more than an individual, because when we run it, we're not going to run it in our silo offices. We're going to run it in a conference room. And then we will have it either live. We started actually live for many, many sessions, and then we realized that it's a little bit hard because they used to run it on a Wednesday. And my dear colleagues used to come at 7 p.m. when it's 7 hours difference, and they used to come at 8 p.m. when it's 8-hour difference. And when they paid it at 1, it became 9 p.m. at that time. So they also came at 9 p.m. and stayed up to 11 p.m. So I'm really proud of all of them hanging in there for 2 hours with us weekly. And we used to do it Wednesday. Then after maybe 6 times, they decided to do it Thursday. I said, this is a kill. Nobody can come on Thursday at 8 p.m., because that's the beginning of our weekend. So at that time, we decided to record it. And now, to do that, we again need an internet support, and we need space. We need flexible scheduling, and that's the piece I talked about. And then we have to have a communication, like we use emails. And then everyone who visits us, we advertise in several means, and Hamad Medical Education office, Dr. Al-Khal and his team were very supportive. Like they help us to populate at Hamad, and we populate it and have actually posters. And then whoever come and attend, we have their contact information, and that's how we generated our listserv. And then when we meet, we have a little bit of refreshment, and then we listen to the webinar together, if it's live or recorded, and then we discuss the topic, trying to simplify the topic or complicate it. We listen to each other, we exchange ideas, and my role basically is to moderate. And then when everyone is quiet, I can be naughty sometimes. So I challenge people to trigger the discussion, we move on. And that's how I facilitate. And then we have an evaluation form, and that was very instrumental. It helped us to change what we do over time, and which I will share also shortly. And then in the beginning, from the planning stage, we have to have a certificate, and we have to have some sort of CME. So we started with CME, and down the line when we have nursing on board and we discovered we can have CNE, we had that also. And for our colleagues who don't need CME or CNE, we have participation certificates. So these are the results. We ran like 14 themes. I'm going to share only a few of them. The first one, we piloted it, and we had very good attendance over the 6 sessions. In the evening, people were enthusiastic, so we got excited. And then we applied for CME AMA Category 1 from New York. And we got it for those two, for student assessment and course evaluation for professionalism. And actually, they trusted us and gave us 24 CME credit points for those two. And then after that, we have team-based learning. And we continued CME from Hamad because, you know, the other process is a little bit complicated. Sorry. And then when we had the e-learning one, again, weekly, when we're done, our colleagues here from the library helped us because in that theme, they were talking about different apps in your gadgets, in your smartphones. So we had a follow-up, several sessions with the library. So they showed them how to download the apps in their own gadgets, and it was a wonderful discussion. We continued, because these themes are either in the spring, on the fall, in between their vacuum. So we tried to continue with different activities. One of them was the e-learning session where we had the librarian to come and share. And then the list will continue. And then after research here, we had another session that I'll share with you. And I'm going to share just part of the evaluation we have. This is like maybe 540 people from like 6 different sessions, and 69 of them felt that the webinar and discussion were effective, and that the discussion and the webinar helped to trigger good on-site discussion and helped them to understand the topic better, those 77%, and 80% they felt it beneficial, okay? And for us, Marianne and I were seeing a lot of changes among the community. Like the people are more relaxed. They can share their opinion. They can have different opinions in the room, and we can also reconcile for one direction or the other. We agree to disagree and all of that. And it built a lot of collegial relationship. And down the line, we have from different disciplines, and actually sometimes we find our colleagues coming from Al-Wakra, which is a distance, to come and join us. We found colleagues from Qatar University. We have residents. We have some students. So we have a mix in the room where they're sharing their opinion. And at some point, some of them can collaborate depending also on the topic and their interest. I'm going to share some other projects stemmed from this. After the 4th session, Marianne and I got excited, and our attendees were excited. I said, okay, we can have a vacuum for 3 months until we have the next session. So we put together something we called it Medical Education Forum. And in that one, we sometimes host it in the college, by the way, and sometimes in Hamad. Initially, we were hosting everything in the college, and then when we went to recording, it became easier because the bulk of our attendees are from Hamad, so we moved to Hamad. And Hamad were generous to give us the space and have their IT person to help us there, and actually the refreshment too. And what will happen, and then when we had this medical education forum, what we did, we brought some topics that of interest, like interactive teaching, like the 12 tips, and other topics. So she and I bring up some topics, some articles, and we generate and trigger discussion. And this is away from the webinar, so just to continue the momentum. And then after we had the research in medical education series, we felt people are interested. We said, okay, You want to continue the discussion? Let's have more sessions. So some of the topics we brought in like authorship. We had also invited a colleague from Qatar University who talked about surveys, and that also kept the momentum. We have 3 different sessions, and then we got too ambitious. We said, okay, why don't we have peer review? We have a bulk of people who are interested, talented, and we meet, and they're willing to come. So even at Hamad, we have invited them for a couple of evenings, and we had colleagues from nursing actually brought their own survey to be critiqued by our colleagues. So they presented their proposal, and they gave them feedback on their survey. And again, we had these technology sessions for 2 of them, as I mentioned, and also it ended up in a presentation in the IMC conference in 2011, and also an Ottawa conference in 2012. So we paused, I know that, for a few months. We have like 4 of them recorded, ready to be run. We just need to be cloned and have extra hours a day. And we're planning to continue. Because the last one really built a very nice momentum was the research interest group. So we would like to continue that and continue the IMC. And how many days a week? So we need to do a little bit of math and we're on it again. Definitely there are challenges. One of them is the time difference. I mean, when we used to come, let's say 9 to 11 at one time, it was hard, but we can continue that forever. And then when it hit Thursday, now they run it every Thursday, we realized there is no way we do this. I reached a point, I polled the group and I asked them what time you wanted. Will 6 o'clock work for you? Because we have to consider the prayers and the breaks and this and that. So we do it around 6 to 8 at Hamad currently, whenever we run it. And then you have to have the audiovisual straight, and then any other support from printing out, because we print out also the handouts and give it to our colleagues there, and the venue. And the funds, because we're at Cornell and Qatar, we have all the luxuries, we have all the resources, we got the maximum out of it. But I want to share with you, you can do it wherever you are for whatever webinar you like. Because some webinars are clinical, some webinar medical education, others related to research and others. And I encourage you to try it. And you can have to subscribe. It depends, some of them are free. And then have a room. You just need a laptop and internet connection and maximum LCD if you're a big group so you can all see. So for example, if you think about the cost, if we don't have all these wonderful resources, I think it will cost you the subscription like $750 if you're not a member organization, if we're talking about IMC, but in others it might be even cheaper. So I really encourage you to do that and have the discussion after. And that's for us, basically, we find how, we discovered a lot of our colleagues, and it reached the point people would come and ask you to mentor them. They ask each other to mentor them in research and other work. So you build a community of networking among the group. So these are a couple of references, and I cannot finish my talk without acknowledging very key people. The medical education department at the college were supporting all the subscription and stuff. Najba Abdel Khalik actually left us years ago, but she's the founder in the beginning from administrative assistant, and then followed by Gemma and Megan. And Idris was the IT person and the AV department at the college, because they stay late to record it for us and then give us the CD. At Hamad, I would like to thank Dr. Al-Khal, who is here, because he's always supporting us, giving us the menu, having his IT person, who's Chris, his name mentioned here, to support us, and Banan always when we ask for permission. And the instrumental person also, Ismail Helmi, because I drive him last minute, we need the CME, and he approves it for us with all the documents he needs. So I'm really appreciative of the whole team involved in this. Thank you very much for your attention.